Does it take you several sessions before you feel you know your patient or client? Do you ask yourself, what is the best treatment for this person? Do you wonder whether you're working this person hard enough? Perhaps too hard? Do you find it difficult to determine the potential for recovery? How do you choose what to focus on first? Is your treatment targeted enough? And the list is endless. If you have these questions running through your head, then you probably are thinking of your patients outside of work. It might be when you go for a walk or a run, or when you cook dinner, or perhaps even when you're trying to sleep. You might be second-guessing yourself. I certainly did. Brain images give you the confidence you need in choosing the best treatment and determining the potential for recovery. You no longer need to second-guess yourself. Join me for the upcoming in-person brain imaging essential course, where you will learn the essential tools you need to extract rehab information from the brain images. This is a 2-day course, which is unlike any course or lecture you attended before. It is practical, it is fun, with lots of hands-on experience and case studies. You'll interact with other clinicians from other disciplines in a new way, and we will be having rich clinical discussions. Recently, a clinician told me that using brain imaging is like turning the lights on in a dimly lit room. So join me for the in-person brain imaging essential course, and let's turn the lights on. Spots are limited, and I look forward to seeing you soon.